Marissa Bryant.
And Janice Pittman.
And this is our Meta Olympics A.
We chose to do antipsychotics, which are used to manage psychosis, mainly in schizophrenia and bipolar disorder. Long term, they can be used for involuntary movement disorders and metabolic syndrome. They act by blocking receptors in the brain's dopamine pathways. And then the 4 drugs we chose were clozapine, haloperidol, haloperidone, and risperidone.
And she says them a lot different than I do, so we let her say the names. We're going to start with clozapine, and the side effects are in pink. The nursing assessments are in yellow, and the special considerations and adverse effects are in green. I know it's very hard to see it on the camera, but the little bitty yellow pieces of paper are actually the routes of administration.
And we'll submit a picture of this with it.
So for clozapine, these are a lot of side effects. I might get a little winded. It starts off with the neuroleptic malignant syndrome, sedation, salivation, dizziness, headaches, tremors, sleep problems, akinesia, fever, sweating, akathisia, confusion, seizures, fatigue, insomnia, depression, slurred speech, anxiety, agitation, dystonia, obsessive compulsive disorder, tachycardia, hypo and hypertension, chest pain, ECG changes, orthostatic hypertension, blurred vision, drooling or excessive salivation, constipation and nausea, abdominal discomfort, vomiting, diarrhea, anorexia, dry mouth, weight gain, heartburn, dyspepsia, urinary abnormalities, a GU frequency or GU urgency, weakness, rigidity, diaphoresis, dyspnea, nasal congestion, death among geriatric patients with dementia, and aggravation of diabetes mellitus.
Okay, and the routes of administration, this one only is taken orally. Adverse effects and special considerations are hypersensitivity, severe granulocytopenia, coma, and pregnancy.
Some nursing assessments for clozapine include the Ames assessment, checking the blood glucose, doing a CBC diff, making sure that they're oriented and they haven't lost consciousness, making sure that they have a normal gait or checking to see if there's any sleep pattern abnormalities, checking for dizziness, faintness, watching for tachycardia and palpitations, asking them if they have those, EPS, constipation, daily urine retention, no strenuous exercise for these patients, and to increase the bulk and water intake to help combat with the constipation that can occur for this drug. The next drug is haloperidol. Side effects include, many of these side effects, by the way, are exactly the same, but for the sake of the project, it has EPS, pseudoparkinsonism, akathisia, dystonia, tardive dyskinesia, drowsiness, headaches, seizures, again with neuroleptic malignant syndrome, confusion can occur, orthostatic hypotension or hypertension, cardiac arrest, changes in their ECG, tachycardia, QT prolongation, sudden death, torsades de pointes, blurred vision, glaucoma, dry eyes, dry mouth, nausea, vomiting, anorexia, constipation, diarrhea, being jaundiced, weight gain, ileus problems, hepatitis, urinary retention, urinary frequency, dysuria, enuresis, impotence, amenorrhea, that's a difficult word for me, gynecomastia, rash, photosensitivity, dermatitis, dyspnea, respiratory depression, and once again, risk for death with dementia.
Alright, and the adverse effects and special considerations for haloperidol are hypersensitivity, coma, Parkinson's, pregnancy, breastfeeding, seizure, hypertension, pulmonary, cardiac, and hepatic disease, QT prolongation, in children,
Special considerations.
prostatic hypertrophy, brain damage, bone marrow depression, CNS depression, alcohol and barbiturate withdrawal states, angina, epilepsy, urinary retention, and the routes of administration are orally, intravenously, and intramuscularly.
And you'll have to forgive her not being able to read this because I wrote it. Some nursing considerations for haloperidol are prolactin, a CBC, doing a urinalysis on the patient, ophthalmic, and you do the ophthalmic before and during the treatments, taking blood pressures while standing and taking the blood pressures while lying, and making sure every 4 hours initially, once the drug is started, to check for the blood pressures, a pulse, and respirations. Dizziness and faintness occur with this drug, as do the feeling of palpitations, tachycardia, EPS, neuroleptic malignant syndrome, and serotonin syndrome can occur. So we have to assess for those. Constipation, urinary retention daily, abrupt discontinuation, make sure that they don't abruptly stop taking the medicine. QT prolongation, with ambulation it has to be supervised, and once again making sure that they're drinking enough water to help combat with the constipation. Our next drug we did was paliperidone. Side effects with this drug are APS, pseudoparkinsonism, one of those two, you messed me up, akathisia, I'm sorry, dystonia, tardive dyskinesia, drowsiness, insomnia, agitation and anxiety, headaches, seizures, dizziness, orthostatic hypertension, tachycardia, heart failure can occur with this drug. QT prolongation, they're at risk for having a heart block, dysrhythmias, blurred vision, cough, dyslipidemia, diabetes mellitus, hyperinsulinemia, hyperglycemia, weight gain, nausea and vomiting, anorexia, constipation, xerostomia, menstrual irregularities for women, and agranulocytosis.
Okay, and adverse effects or special considerations for haloperidone are breastfeeding, geriatric patients, seizure disorder, AV block, QT prolongation, I can't say that, Torsades points, hypersensitivity, risperidone, pregnancies,
Category C.
Pregnancies category C. Children, renal hepatic disease, obesity, Parkinson's, SI, diabetes mellitus, hematological disease.
We're still learning how to pronounce these things.
Yes. And the routes of administration for paliperidone are intramuscular and by mouth.
So on to the next drug. I'll let her say the name.
Risperidone.
That.
Or risperidone. Go ahead, risperidone.
Side effects include EPS, pseudoparkinsonism, akathisia, something, dystonia, tardive dyskinesia, drowsiness, insomnia, agitation, anxiety, headache, seizures, neuroleptic malignant syndrome, suicidal thoughts or ideations, head shaking, orthostatic hypotension, tachycardia. Again, with this drug, they can have heart failure. This one can even cause sudden death. In geriatric patients, they can have AV block occur, blurred vision, tinnitus, nausea and vomiting, anorexia, constipation, jaundice, weight gain, dysuria, neutropenia, hyperprolactinemia, gynecomastia, granulocytopenia, rhinitis, renal artery occlusion, upper respiratory infections, sinusitis, or coughing.
Alright, adverse effects or special considerations: hypersensitivity, breastfeeding, pregnancy category C, children, geriatric patients, cardiac, renal, or hepatic disease, breast cancer, Parkinson's, CNS depression, brain tumor, dehydration, diabetes, hematologic disease, seizures, abrupt discontinuation, suicidal ideations, and phenylketonuria.
That's how I would say that.
Okay. And it's taken by mouth. It's only available orally.
Yes. So, nursing assessments for this drug would be keeping an eye on them for suicidal ideations. And honestly, I'm surprised.
Both of these were suicidal ideations. I'm surprised haloperidol isn't. This one was.
Did I say it up here?
Oh no, not in yours. It should have been. But
so up here, I would also put that suicidal ideations would be a nursing assessment since it can cause for a person to have those thoughts. Thyroid, checking their thyroid function. Once again, analyzing their orientation or loss of consciousness. Watching their gait, sleep patterns, checking for any QT prolongation, dizziness and faintness, asking if they feel like they're having palpitations and checking for that, tachycardia, assessing the EPS. Geriatric patients need to be assessed every day. Neuroleptic malignant syndrome, constipation, daily urine retention, and once again with this drug, ambulation has to be supervised. We found that with antipsychotics, they're pretty much kind of all having the same effects. A lot of them have the same nursing assessments and special considerations. So I would say that giving this drug to a pregnant person, any of these drugs, is probably not the best since they are class C. We put also pictures of each of the drugs, and this one is the only one that's able to go IV or, so we put the little bottles on there. And then that's the little yellow clozapines. These were the...
And they vary based on...
Risperidone.
Yeah, they vary based on manufacturer. So the pill may not look like that, but...
Those were the ones that...
They'll be similar.
They were colorful on a blackboard. I figured they'd go for it. We chose to do antipsychotics because we use these a lot where we work, and we're familiar with how they're used, why they're used, and...
Or what happens when they're not used correctly.
when the side effects of when they're given. And we use haloperidol, I think, probably the most where I work.
We use haloperidol, but a lot of people that come in, a lot of patients that we see, are coming in because they're not taking their risperidone. So they have to treat their side effects or their
mental
episodes.
Issues.
They're episodes because they're almost manic sometimes.
Yeah, they're very manic when they come in.
These
are probably our favorite class of drugs because we do see them used so often.
And we see what happens when they're used.
Yes,
it
helps a lot when they are on these drugs. I think that the schizophrenias and the manic bipolars are probably the worst that help them just calm down it, but it helps them be able to think a little bit more, and that's why we like them, because those people we actually do feel sorry for because they can't help it. This is a disorder that they didn't choose to have.
And at the same time, with how long the list of side effects are, it's kind of understandable why they don't take them, why they stop taking them. I don't encourage that, obviously, but sometimes the side effects can be worse than what they think their symptoms are.
What they think.
Yeah.
Not what we see. So that was our